Hello everyone and welcome to this lecture about fluid resus and management of burns. Okay, so burn injury management, one of the most important things we can do following a severe burn is to provide immediate fluid resus. Okay. The criteria for this is if an adult has over 15% total body surface area of a burn, or a child has over 10% total body surface area of a burn, they will need to have fluid resus. And there's a special formula we do to work out how much fluid an individual should have according to their weight and the total body surface area that has been burnt. Okay. Now these patients do need massive amounts of fluid resus as they lose a lot of fluids through the burnt skin. So you will be getting huge numbers here. Don't be alarmed by that. Just make sure that you're doing your calculation correctly and you're getting it checked by a second nurse as well. So the formula, it works out to be 4 mils per kilo times the total body surface area burnt times the pre-burn body weight in kilos. And that would give you a number in mils, and then we would administer that over a 24-hour period. So it's the first 50%, I'll just put here that it's 24 hours, and the first 50% in the first 8 hours, then 25% in the following 8 hours, and 25% in the 8 hours after that. Now the fluid of choice can be CSL or Hartmann's, preferably, but normal saline can be given if Hartmann's is not available. And again, refer to local policy, and it may vary according to the doctor. Okay. Very important to note that on top of the fluid quantity that we're going to be calculating, you have to remember that your patient will require a normal daily intake of hydration over that 24-hour period. Often with severe burns, they'll be nil by mouth. And the average intake is 2 litres a day. So we need to add on 2 litres divided by 24 hours, which would give us 83 mils per hour. Okay, so it's very important when calculating the fluid resus to add on the 83 mils per hour after you've performed the burn calculation. Otherwise you could end up overloading your patient with fluid because it will give you a different number. So here's how a typical formula and burns calculation can work. So this example is for a patient that was 60 kilos pre-burn weight with 60% total body surface area burn, which is quite a large burn. So we know that it's over the 15%, so we need to provide immediate fluid resus. So the calculation we do is 4 mils times 60 kilos times 60% total body surface area. And that gives us 14,400 mils, which is 14.4 litres, a huge amount. Okay. So 50% of this needs to be given in the first 8 hours post-burn. So this is when we're giving our largest amount. So 50% of this number here works out to be 7,200 mils. Then we divide that by 8. So divide by 8, and because that's the amount of hours we're giving it over, and that's going to give us 900 mils per hour. Okay. Then we break it down, so 25% in the second 8 hours and 25% in the third 8 hours. And these are calculated to be 450 mils per hour. Okay. Then what we need to do is we need to add on our normal daily intake of hydration. So 2 litres over a 24-hour period equates to 83 mils per hour. So we need to add this on to these hourly rates here. So in the first hour here, 983 mils per hour of CSL should be given. It does sound complex, but if you just work a few of these out yourselves and break it down into the steps, it's not that hard to calculate. The key to getting a calculation correct is to make sure that your total burn surface area calculation is correct, otherwise it'll throw everything else out. So let's try an example together. An 80 kilo patient has 25% total body surface area burn, and the patient's nil by mouth, so we need to include a 2 litre maintenance fluid requirements. So the formula is 4 mils times the kilos times the body surface area percentage plus the 2 litres. So what would the fluid requirements be in the first 24 hours for this patient? If you want to pause the video here and work out the calculation, I'll tell you what it is when you come back. Okay, so the answer to this calculation was C. So 4 times 80 times 25 gives us 8 litres, plus the 2 litres works out to be 10 litres or 10,000 mils. Well done if you got that correct. Okay, so moving on to burn injury management, the immediate care as well as fluid resus is that we need to insert an IDC so that we can closely monitor the urine output hourly. And the patient would also need to have a fluid balance chart, and it's likely there will be nil by mouth, so they may need a nasogastric tube in case enteral feeding needs to be commenced. Now they may need a CVP, so a central venous pressure line, or CVL. And that's so we have large bore IV access so we can get fluids into them quickly, and if they do deteriorate we can administer inotropes if necessary. We need to perform regular OBS on these patients and continue with our A to E assessment. And it may be, depending on the extent of the burn injury, that these patients need to go to a specialist burn unit or an intensive care unit. And often they're nursed in single rooms, in negative pressure rooms that are heated to a certain temperature, the very hot rooms, to try and prevent any hypothermia. Okay, so it's very interesting and very complex caring for a burns patient. So thank you very much. I hope you enjoyed this lecture.